and welcome you all to the Superspecialist with me, Dr. Kiran Patil. And today we are going to deal with one of the most common neurological disorder, that is headache. And migraine is very much common kind of a headache. It is more commonly seen in females in comparison to the males. So today we are going to see in detail about migraine. So let's start. Migraine is a type of headache which occurs generally between 10 to 55 years of age group. It has got characteristic one-sided throbbing or pulsatile headache which lasts from 4 to 72 hours and which increases on movement. The migraine patient would experience light sensitivity or nausea or vomiting. Migraine is broadly classified into migraine with aura and migraine without aura. Aura is nothing but the complex neurological symptoms which can accompany, precede or completely occur in isolation with the migraine episode. The aura can be seen different types. Most common auras are visual and sensory auras. There are different types of auras. Most commonly are visual auras, in which patient may have loss of vision in the center, or he can see zigzag lines, or he can have patchy losses of vision, or they can temporarily lose the complete vision also. Then comes sensory symptoms, in which they will have tingling and numbness of hand or heaviness of the hand. They can also have giddiness, or they may feel off balance while walking. These are the types of auras which they can feel. These auras will generally flare up within 5 to 20 minutes, and within 60 minutes of their onset the headache will start. Sometimes there is no headache after having aura, what we call as acephalic migraine. So let's see one real life example of an aura. A student preparing for competitive exam visited my clinic, and he told his story like he used to study late night and again used to get up early in the morning. One fine day when he got up early in the morning, while reading, he noticed that he is not able to see the first half of the words. He concentrated hard and the whole paragraph read the same. Then he started having heaviness of his right hand and right leg, followed by tingling around his mouth. He tried to get up and walk to the hall, but while transit he had giddiness, so he couldn't walk. So he slept up for half an hour, and when he got up then he noticed that he is having throbbing headache on the right half of his head, and again he is having watering from his right eye. This is a classical example of migraine with aura. There are multiple theories which has been put forth for the causation of the migraine. Initially it was thought that it is a neurovascular disorder, but currently central sensitization, peripheral sensitization or cortical spreading depression are the recent ones. It is also known some of the genes can cause migraine in the families, but as per current understanding, it is a neurobiological disorder. One more thing to be remembered regarding migraine is the people who are having migraine, they have got increased sensitivity to the light and sound even when they are not suffering from an acute episode in comparison to the normal people. And during the episode or acute attack of migraine, they can sense that increased light or increased sound as a pain sensation, and not only as a simples or signals of only light and sound. That is why they have increased amount of headache and irritability, and they prefer to switch off the lights and go and sleep into a very quiet room. So there are multiple trigger factors which can provoke a typical migraine episode. It can vary from person to person. For example, sleep deprivation, even excess of sleep, skipping meals or breakfast, travel, certain kind of perfumes. Then you can have certain food like excess of caffeine, coffee, chocolate, cheese, Chinese food which are rich in monosodium glutamate. Then hormonal changes during perimenstrual period. They can set in a typical migraine attack. Every person has got a different migraine trigger, and it can vary from episode to episode also. So it is very important for you to understand what is your trigger, and then only you can prevent it. Yeah, there are certain ways by which a patient of migraine can know that attack of migraine is nearby, that we call as premonitory symptoms, which includes food craving, excessive yawning, lethargy. You can have mood changes like anger, depression, euphoria, stiffness of the neck. So by this they can know that a nearby attack of migraine is there, so they can visit their doctor. There are certain factors which can transform episodic migraine into chronic migraine. For example, obesity, snoring, excess use of caffeine, frequent use of abortive medications, increased baseline headache frequency, These can all trigger a episodic migraine through a chronic migraine. This chronic migraine is not a permanent state, it's a fluid state. That means a patient can go into that chronic migraine and also can come out of it. So it should not be very much taken seriously. Yeah, it's a very common question asked by many patients that whether a CT scan brain or MRI brain is really essential for a migraine patient. The answer for this is, if it is a typical migraine attack without having any neurodeficits on examination, then it is not at all warranted. If the patient's age is more than 55 years, or it's acute severe first time headache episode, or it is associated with epileptic fits, then, or if there is any immunodeficiency associated with that, then CT scan or MRI of the brain may be warranted. Otherwise, it is not at all required. Now coming to the pharmacotherapy of the migraine. There are two types or categories of the drug available for treatment of migraine. One is abortive medications to reduce an attack, and another is to prevent future attacks, that is called as the prophylactic medications. The use of this medication should be restricted not more than 2 times a week. Otherwise, improper use of this medication may lead to chronic migraine and it is very difficult to treat. Also, patients must understand that to get an effect of these drugs, it may take around 1.5 months to 2 months. So they should not discard after using of 15 days or a month and say that it's not working. It's also important to know that all the drug doesn't work same for all. So if one category of a drug is not being properly used for you, you should always have a patience and give the chance to the doctor to decide which is the best drug for you. One of the treatment line for treatment of migraine is avoiding trigger factors. So basically, for avoiding it, you must understand it. So every migraine patient should and must maintain a headache diary in which they write 4 things about the typical migraine episode. First, when did the migraine episode start? Second, what was the duration, how much duration it lasted? Third, what were trigger factors for it? And what all items they had eaten 24 hours before that episode. So once they get their trigger, then they can easily prevent it. So it is a very important step for the patients to know their triggers. There are 2 types of pharmacotherapies available for the treatment of the migraine. One is abortive therapy, which reduces an acute attack, and another is the prophylactic therapy, which prevents the future attacks. It should be remembered that these medications should not be taken more than 2 times a week. And it should be also remembered that it should be taken within 1 hour of onset of headache, because once the migraine attack sets in, then these medications do not work. It should also be remembered that this medication takes around 6 to 8 weeks to act. So patients should not take it for 15 days and 1 month and say that it's not working and discard them. It should also be noticed that these medications work different from different people. So your doctor should be given enough time to choose which drug is best for you, and it should be taken like that. Yeah, there are certain precautions which needs to be taken with the use of anti-migrainous drug. For example, as these drugs cause vasoconstriction, people having a heart attack or a stroke may be very much cautiously use this drug. And also these drugs have got teratogenic effect, means it affects the future fetus. So reproductive age women also should take a due care or visit their physician before planning their pregnancy, so that the safer medication can be offered for them. One more point to be remembered for the patients, that whenever they have an attack, they have to take the medication as early as possible. If the migraine attack has set in, then the drugs are of no use. So you have to carry your drugs with you, and as the moment the headache starts, you have to take it, more importantly, within first hour of the onset of the headache. Yeah, for chronic migraine, there is also pharmacotherapy available, and recently certain Botox injections are also tried, which has found to be very much successful. There can be certain complications of migraine, like episodic migraine can turn into chronic migraine, in which there will be headache for more than 15 days per month for 3 consecutive months. There can be migraine infarction, in which there will be weakness of any of the limbs. Then a typical migraine attack can trigger a seizure episode also. These are the certain complications of the migraine for which you have to take care, so that you don't go into transform into chronic migraine. There are different types of migraine which require specific mention. For example, abdominal migraine occurring in children, in which they will have abdominal pain associated with nausea and vomiting. Then menstrual migraine, which occurs in female during perimenstrual period. Then There is a familial hemiplegic migraine, in which migraine attack accompanies weakness of the any half of the body and which occurs in family. Then basilar migraine, in which the patient is not able to speak and he is off balance, feels dizzy. Then there is a ophthalmoplegic migraine, in which there is diminished of vision associated with drooping of the eyelids. So there are certain specific types of migraine which require some mention.